Introduction. Welcome, medical students, to this comprehensive course on the fascinating field of neurology. Over the course of this script, we will explore various topics related to the intricate workings of the nervous system and its disorders. Each topic will be presented in a detailed manner, providing you with a deep understanding of the subject matter. So, let us embark on this journey into the vast realm of neurology. In this section on neurogenetic disorders, we will explore diseases like Huntington's disease, spinocerebellar ataxias, and hereditary neuropathies. We will discuss how these conditions arise from genetic mutations, their clinical manifestations, and the diagnostic techniques used for evaluation and management. Central nervous system, CNS, infections, including meningitis, encephalitis, and brain abscesses, have a significant impact on healthcare. Bacteria, viruses, fungi, and parasites can invade the CNS, each with distinct features and treatment options. Accurate diagnosis involves clinical suspicion, cerebrospinal fluid analysis, and neuroimaging. Through in-depth exploration, we will gain a comprehensive understanding of these disorders. The topic of disorders of consciousness in semiology covers conditions characterized by changes in consciousness, including coma, vegetative state, and locked-in syndrome. We will explore the neuroanatomy and neurophysiology underlying these disorders, as well as clinical assessment tools like the Glasgow Coma Scale and the JFK Coma Recovery Scale Revised. Understanding the prognostic implications and management strategies for patients with these disorders is essential. In today's world, exposure to toxins and drugs capable of affecting the nervous system is increasingly common. Understanding the mechanisms of toxicity, clinical manifestations, and treatment modalities associated with neurotoxicity is essential for successful patient management. Neurotoxicology encompasses a wide range of conditions, including heavy metal poisoning, medication-induced neurotoxicity, and neurological complications related to substance abuse. Examining the specific mechanisms through which these substances affect the nervous system allows for a more comprehensive understanding of their associated clinical manifestations. Recognizing the symptoms and signs of neurotoxicity facilitates early diagnosis and appropriate medical intervention. Furthermore, implementing targeted treatments and preventive measures can significantly improve patient outcomes. In this topic, we will explore the various toxic agents, their mechanisms of action, clinical presentations, and management strategies. Neurological disorders such as stroke, traumatic brain injury, and spinal cord injury require comprehensive rehabilitation strategies. Neurorehabilitation uses a multidisciplinary approach to optimize outcomes and improve quality of life. This topic covers principles, assessment tools, rehabilitation strategies, and teamwork in neurorehabilitation. In the section on neurovascular syndromes, we will explore conditions caused by vascular abnormalities in the central nervous system. We will focus on lacunar infarcts, cerebral venous thrombosis, and arteriovenous malformations, examining their pathophysiology, clinical features, neuroimaging findings, and management strategies. By the end of this topic, you will have a thorough understanding of these complex neurological disorders. In this section, we will explore less common movement disorders that resemble Parkinson's disease. These include progressive supranuclear palsy, multiple system atrophy, and corticobasal degeneration. We will delve into their clinical features, diagnostic criteria, neuroimaging findings, and treatment options. Neuropsychiatric disorders, such as depression, anxiety disorders, and schizophrenia, have significant neurological manifestations. This video will delve into the neurobiology, clinical presentation, diagnostic evaluation, and management strategies for these disorders, providing comprehensive knowledge for effective patient care. In this video section, we will delve into the world of paraneoplastic syndromes, rare neurological disorders triggered by an immune response against malignancies. We will explore their clinical features, diagnostic clues, treatment approaches, and underlying mechanisms. By the end, you will possess the necessary knowledge to identify and manage these unique disorders. Neurological manifestations can result from various systemic disorders, including endocrine diseases, metabolic disorders, and autoimmune conditions. In this section, we will explore the diverse clinical presentations, diagnostic workup, and management strategies for neurological complications in a systemic context. By studying clinical cases and discussing appropriate approaches, you will gain the skills needed to understand and address these complex scenarios. Rare neurological disorders present unique diagnostic challenges and often require specialized knowledge for accurate management. Stiff person syndrome, Farr syndrome, and transverse myelitis are examples of such conditions, each with its distinct characteristics and diagnostic criteria. Understanding the clinical features and diagnostic clues associated with rare neurological disorders facilitates appropriate management. Comprehensive knowledge of each condition's specific diagnostic criteria ensures accurate diagnosis and effective therapeutic interventions. Throughout this topic, we will explore the clinical characteristics, diagnostic criteria, and management options for rare neurological disorders. Case studies and expert insights will help you gain an in-depth understanding of these unique conditions and their associated challenges. Acute neurological emergencies require prompt evaluation, accurate diagnosis, and immediate interventions to mitigate the potentially devastating consequences. Conditions such as status epilepticus, acute stroke, and traumatic brain injury demand specialized knowledge and rapid decision-making. Understanding the urgency of these conditions and their clinical presentations is crucial in initiating appropriate management strategies. Timely interventions, including pharmacotherapy, neurosurgical procedures, or other supportive measures, can significantly impact patient outcomes. Throughout this topic, we will explore the urgency, clinical presentations, diagnostic evaluation, and management principles associated with various neurological emergencies. By examining case studies and discussing evidence-based management approaches, you will develop the skills necessary to effectively handle these high-stress situations. Through our exploration of various topics in neurology, from neurogenetic disorders to neurological emergencies, we have provided a foundation for your understanding. Embrace the intricacies of the nervous system as you continue your journey in this constantly evolving field.